Good day, my esteemed viewers. You are cordially welcome to another show of Health Media Chats. Today, 18th of September 2020. The show is brought to you. Normally, it should be live, but unfortunately, due to some technical error this hour too, you'll be watching it not live. Brought to you by Adams Head Blog. I am your regular host, Omolola Adams Olatayo. And the topic we shall be discussing is COVID-19 intervention projects, nursing ambassadors of Nigeria's initiative. And my guest is Nurse Ambassador Onoitem David, the publicity secretary of Nursing Ambassadors of Nigeria, also the founder as well. Welcome to the show.
Thank you so much, Mr. Adam. I really appreciate having you.
My esteemed followers, fans, viewers all over the world, please don't forget to subscribe to the YouTube channel so that once a new release is being made, you can have access to it directly and you can receive via the notification for the new release. Before we go into detail, I want to congratulate my guest this afternoon. This message will be coming to him as a surprise because I found out that he has been up and down since almost like, let me just say, a week, thorough up and down, very serious up and down for the election of State Executive National Association of Nurses and Midwives, Akwa Ibom State chapter. And congratulations on your victory as the state treasurer.
Thank you so much, Mr. Adam. It's just that unfortunate that the person that you saw on the video, on the pics, as the treasurer happened to be my brother. So we resemble very well.
Okay, sorry about that. So that was a kind of mix-up. I actually thought you were the one, so that's why I said I'm gonna surprise you with that. But at the same time, I want to believe that there were members of Nursing Ambassadors of Nigeria as part of ESCOs of state, Akwa Ibom State, NAM executive, especially the president, if I'm not mistaken.
Yeah, though in the National Association of Nigerian Nurses and Midwives, it has the national body, and the national body is in charge of all the branches, or you call it council. So in Akwa Ibom State here, we have Akwa Ibom State Council of NAM, but it is being controlled by the national. But here at the national level, before I go in, the national level is where we have the president. But at the state council level, that is where we have the chairman.
Sorry, I think that was the kind of
in terms of the branches of the council, I can, in fact, as I'm talking to you, in Akwa Ibom State, we are doing very well in terms of partnering with the NAM. And one of the things that we have done is to ensure that our members go into the leadership positions so that we can be a problem solver, not to be complainers. So that is what we are doing. And at almost about 70% of the SEC member, that is the State Executive Council, 70% of the State Executive Council members are all Nursing Ambassadors members. And today, I can beat my chest to tell you that 70% or 80, almost 80% of the State Administrative Council are also members of Nursing Ambassadors.
Wow, that was a great number there for Nursing Ambassadors.
So that is what
Nigeria.
we have been able to.
Okay, thank you. Now to our main topic. Recently, to be precise, September 1, 2020, the Nursing Ambassadors of Nigeria launched a project called COVID-19 Intervention Project, which was designed to provide some sort of palliatives to people in the community as well as the nursing community. Also, a courtesy visit was paid to the Director of Nursing Service, Akwa Ibom State of Nigeria. Can you just please tell my viewers at home what exactly is Nursing Ambassador of Nigeria?
Thank you so much, Mr. Adam. Like I keep saying, I'm in my office, right? So most of the time we have our systems around so that we talk to our members and let them understand what we are doing. Nursing ambassadors of Nigeria. We'll just put it in a very brief brief term so that everybody can understand what we stand for. Because a lot of people have been asking, are you people trade union? We keep telling them, and we have to brief them to understand that we are not trade union. Nursing Ambassadors of Nigeria is a multi-specialist organization for nurses, irrespective of your area of specialty, irrespective of your years of service, irrespective of your age, irrespective of the gender. What we do is to ensure that if you are a professional nurse, you are one member and you are willing to be a member, we open that membership for all of us to ensure that what we are doing is to ensure we take care of the rebranding of the image of nursing profession, and we see how we can help in building bridges instead of collapsing the bridges that is already there. We serve as bridges as well, so that we can unite our people and also rebrand the system and the image of our profession so that we can maintain our noble integrity that we normally have in the profession.
Okay, thank you very much. So now, if Nursing Ambassadors of Nigeria is not a trade union, then what synergy or collaboration is there any synergy or collaboration existing in between Nursing Ambassadors of Nigeria and National Association of Nigerian Nurses and Midwives, whether at the state chapter or at the federal level?
Yeah, thank you so much, Mr. Adam. Nursing Ambassador, like I said before, we are to build bridges. We are building bad bridges. And our work is just very specific. It's just to ensure that we build that bridge and we help our people to advance, because that is our motto. Our motto is advancement for greatness. Now, you don't just advance for greatness if you cannot have a good synergy. And you cannot advance to greatness if you don't relate with other organizations well. You cannot advance to greatness if you think that if the parents bears their children and the children come up and it doesn't have a fruitful relationship with the parents. I don't think that is in fact, it will go well with the children. So we are like children and we are partnering very well. We have a very fruitful synergy with the NAM, both at the national level and also in the state level. And as I'm talking to you now, we have about 13 branches of nursing ambassadors across the 13 states of the Federation. So we are working in a very fruitful relationship, not just NAM alone. We're also partnering with other nursing organizations like Ugonsa. We are partnering with them, like Forum of Local Government Nurses and Midwives. We are also partner with other organizations like Nurses Got Talent. We also partner with Nurses Administrators Group. We also partner with the Nursing Wall. We have very fruitful connection and so that we can move our profession forward and let the public know what nursing is all about. It's not just that when they see people wearing white, they just believe that that is the nurse. So our work is to ensure that we partner with this, our mother body, and other organizations like your agency right now that I'm talking to you. This is a partnership. So we have very fruitful synergy with our mother body.
Thank you very much. Thank you very much. That sounds very, very interesting in the sense that have you not been having this kind of challenges that if you are coming up and having a kind of collaboration and synergy with all these mother groups that you have mentioned, but somebody will just come from somewhere and say, you guys, are you registered?
Yes, you're right. That is the same question that, in fact, most of the people have been asking us. Are you? We cannot just exist as an organization without being a registered body. And number one thing is that as an organization, and number two thing just follow is to ensure that we maintain that autonomous and maintain our independent duty. We also have that intention, not just that intention, we have that vision, which we are still processing. We are almost at the last stage of getting our registration number with the Corporate Affairs Commission, and that has been taken care of. but very soon we will have our number. So we are not just an organization without having formal procedure so that we can exist and also partner with not just nursing organization alone, but with other with other organizations outside nursing profession.
Now, thank you. If all this synergy is existing, what exactly is your organization bringing to table for Nigerian nurses and globally?
You know, it's just like what I said. Our motto alone should be able to even tell somebody what we stand for and what we can bring to the table. Our motto is advancement for greatness, and also with our name. In fact, our name alone should even tell you that we are representing the profession. We are also representing our the good citizens of Akwa State and Nigeria and other states in Chile and even the world. That is why the name we call it nursing ambassadors of Nigeria or your people. Ambassador, you must be able to show a good example. For you to be ambassador, you should be able to enlighten your citizens. For you to be ambassador, like what is going on right now in the quackery that many people are going in doing the training everywhere and just claiming like a nurse. In fact, just like what I received a report yesterday, few people who had to go and fake nursing certificates and nursing notification using nursing and midwifery council letterhead and claim as if he's a registered nurse and even got the guts to go to state government and look for a job. And that has been taken care of. The two of them has been apprehended in a Ebonyi state. So this is what we have been doing, and we are reporting every day to know that we have a lot to do to to defend our citizens and also educate our people, and also at the same time, because if your people does not, your members does not advance in leadership and also academically and also in the clinical proficiency, you cannot really get what you want. So we are also interested in ensuring that our people, our members, also advance both in academically, in academic way, and also in the clinical, where have that competency to be able to detect which one that is not right to be given to our citizens, and at the same time partner with the citizens to enlighten them and let them understand what nurses is all about, nursing profession is all about, and what we stand for, so that they will not just go and see somebody outside wearing white and he tells you, turn your buttocks, let me give you an injection. At the end of the day, you start having abscess. At the end of the day, you can't even walk again. So it means that you don't know who you are. As a citizen, you start saying that he's a nurse, and you still go and see somebody on white on the road. You now call the person, how are you doing? The person starts giving you a kind of bad attitude, and you say, oh, all nurses are very bad, are very wicked. They have bad attitude. So these are the things that we are bringing up to the table so that we enlighten the public and also let them understand that they have their right to defend themselves and understand what any professional, the procedure or the treatment is given to you. You don't just go into the hospital and take treatment. That is why I must commend the President, Federal Republic of Nigeria, and also the state governor, who are doing everything possible to ensure that the Patient Bill of Rights is being circulated and also enlighten the public to know their rights. So that is what we are also doing in our own organization. Not just that alone, and also to ensure that we enlighten the public about nursing profession and also help the nursing profession so that we can rebrand our image and take that noble profession back as it used to be to reality. So that is what we are doing, and that is what we are still have a lot of things to bring to the table, like what just happening that the last palliative. The last palliative was not just to protect the members alone, because if you know that you are
Sorry, I have to. I have to cut you off at this time because
a nurse
we are
who is
still there.
rendering a service to transfer the
Sorry, I have to cut you off because there is a question that is coming up on that. So that before you, yes, there is a question coming up on that. Yeah, it's quite interesting because I can see that you are basically focusing on um, competencies both in academic and clinical proficiency as well, which is very essential for the profession as well. But I want to come back to the main topic that we wanted to talk about. You,
Mm.
you launched the COVID-19 intervention project. To some people, they were asking, not in COVID-19 intervention project, are you a government agency? Because it's flying all around the news. The news is flying all around that the government provided some palliatives, some allowances, some health allowances as well. But now we don't really understand why this COVID-19 intervention project from nursing ambassadors of Nigeria.
Yeah, Mr. Adams, nursing ambassadors of Nigeria, as the name connotes already, and like I said before, it's not just a one-man organization. It's an organization that belongs to all nurses. And there were some nurses that in 2017 that came up with that vision. And we team up together and say that we can do something. And what can we do? We need to come out together and assemble ourselves together and form this organization that can serve as a bridge between the nursing profession and also the public, which our mother body are also doing. What we are just doing to ensure that we complement with what they have already been doing. And as such, whether we are partnering with government, whether we are government agency, we are not government agency. We are non-profit organization. And as such, also, we are also a professional organizations where we ensure as a profession, we ensure, as a profession, you have ethics and etiquette. So you don't just go outside the point. So does not mean that because we are organization, we go outside the professional ethics and such. What we do is that we are not partnering with any government. Government is not funding us. What we do is that whenever we want to do something, because we have like minds, we have great minds, and we have people that understand that they need to provide for the citizens, and we have people that understand that they need to provide for the profession, that an engineer will not come there, will not come from outside and come there to come and help nursing profession. A medical doctor will not come and help nursing profession. A pharmacist will not come and help nursing profession. A pastor will not come and provide for the nursing profession. The professionals in nursing should be the one to team up together and provide for our citizens and also provide for your members. So in nursing ambassadors, we don't get any funds from government. So what we do is that whenever we have an occasion like this and we have a project like this, our people are so eager to contribute. Our people are so eager to contribute. In fact, sometimes you will not even look for the money. They will be the one to call you. What do you have? How much do you people have? How much do you people need? This is what we are doing, and this is what we are still intending to do, and we will continue to do that because we don't want to make this organization to be a kind of financial burden to our members. But we do it voluntarily. We do it by donations. We do it by people coming in and say, "Oh, I have seen what you have done." Just like what you have done now, where you are is very far away from Nigeria, and you still have that interest to connect with us. It means that this is the own contribution that you have done to ensure that you announce to the world to know that Nursing Ambassador of Nigeria is there in Nigeria and is actually helping our citizens and also helping our members. So we are not getting any finance from any government. We are not political and we don't want to be political. We still remain professional organization.
Thank you very much. Thank you very much. Because I was actually going to ask a question about funding, but you've talked about that. But I still want you to please kindly convince my viewers and my followers, because we are all aware, it is a known fact, that one of the professionals with low salary in Nigeria are Nigerian nurses. Now, if the group are made up of nurses and we have this kind of gigantic projects in front of you and you are working on it and it is coming out and it is achievable and you are doing it and it is seen, because I personally, I saw some of the pictures on the Facebook, so I saw what you have done so far. But how do you now want to convince us? Because the salary of nurses is so meager, is so small, and yet this project is still coming up.
Yeah, Mr. Dam, there is difference between you having the money and another thing is for you to spend the money. So there are some people that will have the money in their house, in their accounts, and they are so much, but they don't have the willingness to spend. But a little that you have, and you have that willingness to spend, in fact, you can even get enough. You can even get from where, in fact, nowhere that you places that you didn't even expect. So I want to tell the public that we are not, sometime in Nigeria, as nursing ambassadors of Nigeria, we are not trade union. We are not there to fight for our welfare. NAM is actually, and I must applaud them, give them that, in fact, that sense of belonging and that appreciation, because they have been doing a lot to ensure that our welfare is improving. But as nursing ambassadors, we are not really focusing on that. What we do is that if we have problem, we report to NAM, our mother body, and tell them this is where we are having problem and we are not comfortable with this. Everybody already, almost all the continents already know that our country, we are developed countries, and as such, we're having very minimal in terms of payments, and that is why you are seeing most of our colleagues are actually migrating outside the country to practice where there are good packaging. But for us here, we will not all leave our country just like that, because we know we value our citizens also. That does not mean that if any opportunity there, we cannot tell you, okay, let's go and see what is happening there, so that we can come and have that experience and still come back and contribute a little that we can to our country, because nobody will come into this country to help. So what we do is, in terms of that one, is that the payment, the salary level in terms of the salary is actually minimal. But the little that we have, that good heart to ensure that even though with the small salary that we have, we still have to contribute a little portion. Because if you are in the nation and as a profession, you don't have any contributing to the factor you don't contribute to the GDP of the nation, and you don't contribute to your citizens, it means that you don't even want to be a profession, irrespective of the salary level, which I believe that the government of Nigeria and also the government across the states in Nigeria should be able to look into this case of our welfare. Because we have good intention, we know what we would have done. We would have done a lot of projects that will help government a lot. It's not just to do palliative like what we did, but we can also go to different hospitals and tell them, okay, this is nursing organization, nursing ambassadors of Nigeria. We want to build an intensive care unit. We want to build cardiology unit. We want to do this. These are things that we can contribute. But with this kind of minimal pay, that one, even your transport, you cannot even take. But what we still have to have that good heart in contributing and in saving our people and also contribute to our nation. So that is what we do, and we have that good heart. So with you, which I believe too well, you are a Nigerian, and with where you are, you can also keep advocating for our countries and also support our mother body to ensure that the welfare of nurses in Nigeria is improving. Thank you so much.
Thank you. That was such a very fantastic response there. Now, there is another interesting aspect too, is that the project was actually launched in Akwa Ibom State. Have you been able to spread the tentacles to all other states of the country as well?
Yes, and let me use this opportunity to thank my chairman, the state chairman of Nursing Ambassadors of Nigeria, in the name of Nurse Ambassador Bright Ifang. That is his name, the chairman. You know, I took over, we started this organization. When we started this organization, we started in 2017, and I only served as leader of that organization in just 6 months as a caretaker committee, and the present chairman took over and also served as a caretaker committee in 6 months. In that symposium, where we nominated him unanimously to take up the leadership of the organization and continue, which is still continued till today. But we are still believing that very soon we are going to conduct another congress, which the new faces will enter and the people will take up the leadership aspect. So in terms of spreading our tentacles, he has really helped a lot. In fact, I believe in his word, and I'm so happy with what he has done. He has gone around to ensure that we establish these branches. Like I said before, that we have 13 branches across the 13 states in the Federation. So we are not just in Akwa Ibom alone, but Akwa Ibom remain the national headquarters because in Akwa Ibom, as I'm talking to you, we have more than 5,000 nurses that has already registered to be members of Nursing Ambassadors, and we are everywhere. Whatever that we're doing in terms of health, Nursing Ambassadors is also called to be represented. to represent that. So we are doing well. We are spreading our tentacles well, and we are relating with our other counterparts in other states very well.
Now,
that is what we have been able to.
Thank you. Now, I know some of my viewers and some of my fans might be they might have this interest too, because due to what you mentioned about the mission of the organization, they might be interested as well and they want to be part of it. Is there any procedure to be a member of the group, or and then if anybody wants to be a member of the group, what are the channels to follow or what are the ways to go about it?
Yeah, thank you so much for that questions. Mr. Adams, in any organization and in any official organization like this, you must have procedure to admit members. And just like we said, we all know, you all know that this is a profession. And for you to be a member of Nursing Ambassador, you must be a professional nurse. And not just a professional, you must register with the Nursing and Midwifery Council. And you must pass through that training. And you must be satisfied to understand that you are a nurse, not the quack nurse. So we don't just admit any person like that, except you are a nurse. And it's open to all nurses, in as much you are a nurse and you have a good intention to bring good innovation, to rebrand the image of our profession, and to contribute to the innovative ideas on how we can move our profession forward, and also to contribute a little that we have to the GDP of this nation and the GDP of the states. And as such, let me shock you small, Mr. Adam. Just of recent, I had a call, I had a message from our counterpart in India who chatted with me, and today, in fact, he indicated interest in joining the organization. And I also had another person, another of our counterpart,